please.
I have a question on health care. President Obama's health care plan actually helps my family. I have 2 daughters in college, and they're working, and obviously they will benefit by being on our insurance till age 26. Thursday, I believe, the Republicans just rolled out their Pledge to America, and in that document, I didn't read the whole 21 pages, but one of the umbrellas of that, one of the planks of that is to repeal the current health care and look at changes. It's very vague. So I guess what I'm wondering, as an independent candidate, where do you stand compared to where our president is and where the Republicans are with their plan? Whereabouts?
Yeah.
Where do you feel? And would you have supported a public option? That's the second part of my question.
I'll answer those. And the Pledge to America, I read through that. I would not have signed on to that. But on the flip side of it, also with President Obama, I wouldn't have signed on to supporting the health care bill at all. And the reason why, sure.
For both, tell why you would not support either one.
Well, the Pledge to America is actually, there's some things in there, especially in terms of like foreign policy, like they want to continue funding missile defense and supporting these wars abroad, which I am completely opposed to. And I didn't mention in my opening remarks, but if someone wants to ask a question about the wars, my stance on the wars is I'm for the orderly and immediate withdrawal of all troops from both Iraq and Afghanistan. And I believe that the true way to address terrorism is actually by going after these terrorists that caused 9/11 with small groups, and with these small groups capture them and bring them to a court of law. Back to healthcare. My stance is I think that your health is too important to be held really in the hands of a federal bureaucrat. And I think a lot of the problems that we have right now, and really the key thing that bill doesn't address, the Republicans don't address, and the Democrats don't address, is you have to destroy the cartel. And what we have is a government-sponsored insurance cartel. It doesn't matter whether you go to each state.
Define cartel.
Sure. A cartel is a small group of companies. Like, for instance, one of the ways, whatever state you're in the United States, you'll probably only get a selection of maybe 5 companies. So literally, what these companies have to do is they have to start a new firm. They might call it Humana or United Healthcare or whatever, but they have to start a new firm for each state. And portability over state lines is not allowed. So if you want to buy, if New Jersey has say a firm over in Phillipsburg has a cheaper health care plan, you are not allowed to, by law, go ahead and purchase it. Now the other problem on the state level is that we have these mandates where they tell the insurance companies, you must cover everyone for this, this, and this, and this. And it might sound like a good thing, but it adds up to about 15 to 40% of your premium. And in a lot of cases, you might not want to, have coverage for whatever is going on. For instance, if you're male, you might not want to have, protection against ovarian cancer. But by law, you are, paying for these things. So back to the whole idea of like this cartel. It's ridiculous to believe that Congress actually wrote that 2,000-page bill. It was written by the healthcare lobbyists, and you have to be very, very careful because what the true problem is with healthcare is, from my perspective, is the cost. Like if it costs $300 to go get an MRI or some exam done, or if it costs maybe $500 for overnight in the ER. That we would kind of be okay with that, but that's not the reality. An MRI might cost $2,000, $3,000, and a night in the ER might cost $17,000. But you have to ask yourself, why is that? Why do you actually, why is that cost so high in the first place? And a lot of those things it all goes back down to the government interventions. Like, for instance, a lot of people talk to me about pre-existing conditions. And if you had and if you ever notice whether whether you're working for a school district or for a firm or whether you own a business, every year you have to enlist, you have to fill out open benefits and everything. That's part of actually what the cartel does. So if you get, let's say today you have like a heart attack, and then you go to them and say, oh, can you guys cover me for these existing conditions? They say, no, you just had a heart attack, we're not going to cover you for that. or you're going to pay off the wazoo. If you had a free market in healthcare, what you could have is these contracts that are maybe 5 years or 10 years. Maybe you pay a little bit higher of a premium, but these healthcare companies are not allowed, and nor do they actually wish to provide something like that to the public. But what the public would then have, in the case of what you mentioned, I forget, I think it's like 26 and under or something like that for your sons and daughters to be covered under your plans. The companies could easily, offer that themselves, and if there's some way for the money to be made, obviously you'd have all types of companies competing.
Okay, well, in my particular situation, we wouldn't have to go out and get another insurance. They would just be placed on ours. And, the one thing I'm not clear on, you just mentioned about the pre-existing and all that. That's part of President Obama's platform, that pre-existing is no longer going to be part. That's what they were trying to move away from, because there's millions of people that aren't covered. I mean, our children. I mean, I used to teach in the inner city. I used to give my parents at parent conferences chip cards. This is the number you call, because my students didn't have health care.